Welcome to Vision to Value, the podcast that pulls back the curtain on how technology is planned, purchased, and implemented in state government health and human services agencies. Each episode explores the real challenges of transformation, from procurement pitfalls to leadership strategies, and provides bold insights to drive meaningful change. Your hosts, Carol Hussey and Tony Matthews, bring decades of experience from both public and private sector leadership. Together, Carol and Tony bring unfiltered insights and straight talk on what works, what doesn't, and how agencies and vendors can turn vision into real value. Now let's get started. We are honored to welcome Rich Bowlen of Cordata as our guest. Rich began his career as a frontline caseworker and a lay guardian ad litem, fiercely advocating for children and families in Ohio's juvenile courts. With decades of leadership in child welfare, he's championed everything from strategic planning to 4E waiver innovation. Now, a senior vice president at Cordata Healthcare Innovations, Rich leads the Child and Family Services practice, helping bridge the gap between public systems and community providers.
Hi, everyone, and welcome back to Vision to Value. And this is our podcast where we discuss transformation of human services programs. And that can mean a lot of things, right? Practice, technology. Something I'm super excited about and interested in is cross-programmatic service delivery, how we get better about coordinating our services, not just across government, but also with our private sector and nonprofit partners, for example. And so you'll notice my normal co-host, Tony, is not here today. But we have with us a longtime friend of mine, Rich Bowlen. So I asked him if he would be interested in coming on to talk about this, because I know he's equally passionate about this topic. Rich is with an organization called Cordata. And I'm going to ask you, Rich, to just share a little bit about your background and what you do at Cordata before we jump into today's topic.
Absolutely. Thanks, Carol. And thanks for doing this vision to value. I recall, even before meeting you and in my previous life in the public sector in child welfare, you were always thirsty for information and folks bringing some of this awareness and some of this other advocacy to you. So you knew that a lot of times in your office, you felt, am I the only one thinking this way? So thank you for doing this session and providing this. And so, and then thank you for inviting me along. As you know, I have talked over the years, I love to advocate. I was sharing with someone the other day that I had a foster parent one time tell me, I was asking them this, like, gosh, you guys do all this and you do so much and you're so giving. And they said, for all that these children and families go through, this is the least that we can do, is to get out there and advocate for them and their needs. So I'm happy to get to do this. So yes, so thanks for having me. Rich Bowlen here. I started, a long time ago, late 1989, as a frontline caseworker in child welfare, and spent nearly 30 years all in child welfare, from frontline caseworker up through administration, and finally serving as the director for a child welfare agency in Ohio, where I'm based. Still today, I'm including some time at the public defender's office as a lay guardian ad litem, doing abuse neglect cases and things like that for kiddos. So this has always been where I've lived. So I'm happy to be part of this. Joining Cordata just came about. I had a good friend, colleague at Casey Family Programs, and they were talking about some things. Gosh, this was in 2017, 2018. Some exciting work that was going on with Cincinnati Children's Hospital and Hamilton County Job and Family Services. And a group there, just a couple of pediatrician and child welfare researchers, some caseworkers and administrators, said there has to be a better way for us to communicate on the critical information that we have regarding the healthcare, behavioral health needs of our children that you're seeing in your records and your diagnosis and your planning, and then what we're trying to do on our side. And we're trying to get this information not only into our CWIS system, but we're trying to use this for pre-placement activities, for discharging, for supporting foster parents and kinship. But the length of time to get the information, then even to understand the information, it was the windows of opportunity to really improve the outcomes for the kids that we were serving had far passed. So they started doing some work, and as we started talking about ways to help and support that, I just got completely sucked into like, this is the next mountain that we have got to tackle. As I said, I started a long time ago, so before I get too old to climb mountains, I thought I think I got enough fire in the belly left to take this on. So Cordata, as they started to put some things together, um, uh, the healthcare institute, Cincinnati Children's Hospital, started to develop some tools to use to help that process. Well, very quickly as that process started, and they started seeing almost immediate positive results with their work, the accompanying hospitals in there. So Ohio is a county administered system. Each hospital with their county partner said, hey, you're not the only one struggling with this. Can we join? And so the hospital very quickly said, you need to find a team to support this, because we're a hospital, we don't support these type of tools. So since I met Cordata, and they just said, hey, the only challenge you have is you got to go find Rich, and you got some baggage that you're going to have to bring along, and you're going to have to take that guy with you to kind of help work with some of the child welfare needs. So, even for the topic that we're approaching today, yeah, the solution seems really obvious, easy. It's right there in front of us. But as everyone knows who works in this field with these different systems, and then to honor the privacy and respect of families and children, it's very complex. So that's what I've been doing for the last 3-4 years now, is climbing this mountain one pebble at a time, it seems.
Yeah, no, it's incredible work, and it's so important. And I started getting into it myself like 3-ish, 4 years ago as well, thinking, I mean, we've been talking about interoperability for over a decade, right? No one's really been doing it. By the way, Rich and I both also sit on the interoperability work group with the Human Services IT Advisory Group. And last year, I had the good fortune of attending HIMSS, which is a very large trade show, and participating in what they call the Consent Learning Lab. And, over the years, when we talk about interoperability, we get a lot of, no, we can't do that. No, we can't share information. And what about HIPAA? And what about FERPA? And people are pretty quick to throw the no's out there and explain it away with what they think the policies are. And so I got really excited about the Consent Learning Lab, because that's a way to alleviate some of those issues. And some of those issues are perceived, FYI. They're not all real issues. It's just lawyer talk. But, there are certainly ways in which, if done properly and with good intention and with open communication, that we can get our clients to agree to have their information shared for good things and to help them. And so that's what we're talking about today. We're calling this episode Navigating the Privacy Dilemma, and how consent management can actually transform family support services. And, we specifically want to address today social determinants of health with children in care. And we will talk about the role of technology a little bit, because, I mean, the technology can do it. That is the least of our concerns. We can build solutions to do that. So we'll touch on that a little bit. But we want to talk about the importance of community coordination, right? These things don't happen in silos. And so the different funding streams and the different layers of service delivery are really important. And so we'll talk about that. And along the way, you'll hear about the really cool things that Rich and the team at Cordata are working on. So, and as an aside, I'm not being paid. Rich is not sponsoring anything. I just think it's super cool what they're doing, and we have got to start doing things differently. And that is why I invited Rich to join our episode today. So let's start talking, Rich, a little bit about the human cost of those siloed systems that I just mentioned, right? The revenue streams and the policies and the regulations and the lack of coordinated care. What are your observations about the implications of that on the people who are being served?
Yeah, that's a great place to start, because that's what drives it all, right? And I think Carol, you and I have talked about it I've been kind of using it as a mantra this last year or two is, for so long we kept hearing, we just get upstream, just get upstream. And if you talk to the folks that have been doing this work for a long time, it's like, hey, we've been upstream. We know what's upstream. We know what it looks like, up there. So the thing is, once you get up there, and why this interoperability discussion becomes so important is, for me, I always thought so again, social worker, not the tech guy, but love what tech, because you can see what tech can do, right? And so for me, what interoperability in my social worker brain, right, is it really comes down to the three things. It's access, empowerment, and coordination. And so when we look at the social determinants of health, and you don't have to really look any further, and I might lean on a little more heavily my child welfare experience, but it's across our health and human services spectrum, right? But you don't have to look any further than some of our youth that are emancipating from care and how they do with housing, employment, their own physical health, their own mental health, any of those things, that they're exiting a system, right? A system that was brought them in, that we were going to do better by them than what they had. And then we look at some of the outcomes that they're getting, and immediately upon emancipation, how quickly they end, that population finds themselves homeless or finds themselves incarcerated, right? So when we talk about social determinants of health, and this topic that we're looking today, especially around privacy and access and consent, and then what tech can do about bringing those things together, we really are focusing, at least in the work that I've been involved with all my life, is the families and the children that are coming to us. They've already kind of experienced some of those challenges with their own health, with their own employment, with their own housing. They've already kind of started at a disadvantaged point. Bringing them into a system that is siloed and fragmented and broken up, that doesn't allow a continuity of care, doesn't make it easy for those pieces to connect, we just start amplifying some of those type of things. And because those don't get taken care of, because they're not resolved, because we make a referral and they may go to the first appointment, but we never follow through with all the recommendations, or the child moves, or there's reunification, there's a custody change, whatever the things happen, right? And all of these little breaking points, there's a lack of continuity of care, and we can't ever finish those loops on things. And a lot of it, when you go back to, and the first pebble I started on this mountain is, gosh, what if the right people just had the right information at the right time to make decisions? It takes so long today just to make the request for information, to find out who has the information, then to get the information, then for the information to come to me, and then me as a social worker, right? I'm reading volumes of medical documentation or mental health diagnosis, and I'm familiar with the terms, but I'm not a pediatrician, right? I'm not the care coordinator. And then I'm trying to take that and tell a foster parent, or I'm trying to tell the parents, the family of origin that we are working with, this is what it means, and this is what it is. So all of those little points of disconnect contribute to a widening gap, that when we look at social determinants of health, it's no surprise, right, that our families and children end up with some of those outcomes. And the movement to start having Medicaid say, listen, we have to start looking at how Medicaid can support some of the issues that are associated with eliminating some of the disadvantaged pieces that contribute to social determinants of health, like, finally, right? Like it's a really good thing to start doing that. So as we start seeing those things line up, I think it's incumbent upon us to start finding out, like, I have to find a way to support the people that are immediate in this child or this family's life, so we can see what those things are that are in front of them, and help avoid or navigate them with them, right? And empowering them to be able to do those things. But the instability that and the lack of continuity of care that we experience when, again, when a lot of our kids and youth are going through these systems, right? I think just amplifies the impact of what we see as, and what we refer to in our social determinants of health.
Yeah. No, that's all. I think you've painted a pretty clear picture, of why it's so critical that we're looking at interoperability and consent. I think one of the challenges that I've observed is that, no one kind of owns interoperability, right? It's everyone's responsibility, and yet it's no one's responsibility. And so even when we think about tech, like where would that tech sit? Who's going to maintain that? Who's paying for it? Because, within the silos of all of these various programs and, not just state agencies, but the healthcare and providers and all of that, they all have their own, IT systems and their workforce and their policies. And so, I think everyone would agree it's important, and they can directly relate that back to the outcomes that you just mentioned. But there's not been a lot of thought given to, is who's going to lead the charge? Who's going to be the one to
Mm-hmm.
say, we're going to make this happen? And I'm sure you've encountered that even in your work at Cordata in trying to coordinate between healthcare, children's hospitals and a child welfare agency. And sometimes it's not even about the money, right? Sometimes it's about priorities and fear and politics and a million other things, right? That are preventing us from moving forward. Would you agree with that?
Yeah, absolutely. And as you were preparing that question, I called to mind even when I was so excited when we moved to trauma informed care, and we were working with our communities at large, and really putting an effort in to inform all the other systems, whether they were court, education systems, other social services systems, what was meant by trauma informed care. And it always comes back to like that middle piece, right, is being informed, right? So that's the critical piece about making sure that we know that. So but you're absolutely right, Carol. Like the whole where it all starts is like, hey, this is if this is so valuable, it's so important, it's so needed, and it's such in demand. Why isn't this happening faster? Why is it, why aren't we doing this? I hear you tell me that the tools are there, the technology's there. So, but as with anything, I remember way back in the day when we in child welfare said, you will never see us put data in the cloud. Like that's never going to happen. That's just not going to be something that we're going to go to. And so we hear some of the same things today, right? Around, listen, unless you get the medical decision makers' consent on every single thing, and there's really good reasons around that. But I think when we say like, why isn't this happening faster? If the tools and the technology are there, why don't we see that? So, there's and so even starting this work, right? I knew kind of going in that there were going to be a couple of key pieces that were going to be major challenges, and they're absolutely major challenges. To the depth and how far-reaching and those tentacles go into other areas and departments, like you said, it's not just healthcare, but it could be with a managed care entity, it could be with other systems, there's multiple people involved in contributing information, right? So, and then when you start looking at that and say, okay, well, listen, we're going to bring all this information together, and if we can make sure that there's a good consent, we can start doing that type of this thing. Well, when you go into some of the programs or some of the organizations today, I hope folks aren't surprised, but there's a lot of folks that are still on manual processes using paper for different things, and there's not a digital data set or record to contribute to. And then even when we look at, okay, well, let's go with the big ones, right? We have like EHR systems, we have child welfare systems. We start looking at just bringing those. Not everybody's using those same systems. So, so one of those key things, if and so I appreciate the way that you started this because I like having these conversations because it's not about one of us doing it for everybody. It takes a partnership among all of those. We're not the only ones working. There's other people doing this. There's other people doing the work that you do, and so finding the right team of folks to help solve what you're prioritizing for your state or for your keeping children and families in foremost. You have to require, hey, all you guys got to get together. You all have great tools. You all have great things. I need to see you working together. If you want me to start trusting other people and sharing data across systems, I need to see you all working together
Yeah.
and doing those type of things. Um, so that, that's one of the big things. And then obviously the other major challenge that I learned that, why this isn't happening much quicker is, so when you start to address those key issues and we look at things like privacy and I as a kind of, on the fence when TEFCA came out, and it's kind of looking at some of those standards for what that looks like and some of those type of things. I thought, well, gosh, another list of standards. Like, don't we already have enough standards around sharing information? Um, but when you see the little steps that are being taken, right, to say, but that's, for one time. But if we're going to move to this future, and to do those type of things, it's going to take the technology, but there also has to be a cultural shift in all of us to understand what those things are. And I think trying to um, help better define what those standards of practice are and what those rules need to look like. And so if I want to build those into a system that recognizes things, I need to know what the modern and up-to-date rules and requirements are. So with all that, the other big challenge I know that we face, all of us are facing, is that when you talk about something this big or this complex, and especially when you're talking about confidentiality, privacy, rights, those type of things, the level of security and the level of sophistication that you need to go through within your, your technology platform, but then also that transfers to your operations and your protocols internal. That cost, right? There's a price tag with keeping the latest, greatest security in place and making sure that those things are, and then training staff and developing staff, creating new protocols and new workflows and things like that. So once you start going like, okay, this works, you also, and when I look at like state health and human services and something like a healthcare industry, it's not just trying to slightly, turn the adjust the sails on the ship. You're talking about a massive,
Yeah.
massive, battleship that you're trying to turn on a dime, and it's just
Yeah.
it takes a lot of work.
It
But
does.
worth doing, because I think those that come after us, right? Like somebody did the work that we're building on today, and I think that's what, again, getting it a chance to share with you and have this conversation today is, if that's what I tell my colleagues, especially those that are like middle management. Just, it's embarrassing how old I feel. I meet some folks like, I'm the director now. I'm like, oh, I think I remember when you were hired, right? So, but that is the new group, and so you want to, if there's something hard that needs to be taken on, if we can make it a little less hard for the next group to keep building on that, I think that's the work in front of us. And
Yeah.
so policies today, even some of our mindsets that might be in, in roles at state offices today, too often it's met, well, we can't do that because A, B,
It,
and C. Well, I think that's our role, though, right? As somebody that cares about these families, and if we want to see real empowerment, we want to really see individual decision making, client decision making. Even we were on a discussion about like things like my chart. At 14 years old, a youth can have access to their my chart, right?
mm,
So if we're going to start really having informed consent and how my data is being used across these systems, I want you to do that. I just
yeah.
want you to do it responsibly, ethically, and for the good of me. So then the work ahead of us is, how do we need to create those possibilities for those things to happen, and not
Mhm.
just shut them down to say, well, we can't do that because
Yeah.
I'd rather make sure that we can't get sued by just saying, no, we're not going to share, than to be courageous or brave enough to say, but the right thing to do by this family and child is to empower them and give them the ability to have that. That means I'm going to have to do some really, really hard work around policy and business rules and things like that. But that's the work ahead of us.
Yeah. No, 100, all of those things are just so right on. I mean, even if like, I mean, first of all, we have to always stay grounded in mission, right? Like if we really truly want improved outcomes for people in our communities, that has to drive the work that we do. And so if we know that interoperability and data sharing can help us to deliver better services to result in better outcomes, then we are compelled to do that because that's the business we chose to be in. And so, you know, aside from mission, because that's first and foremost, we should all want to improve, you know, our experience for our workers as well, creating those operational efficiencies that allow them to do their jobs better. You know, I work around the country, and even in small jurisdictions where everybody knows everybody in the town, they're already sharing this information. They're picking up the phone and they're calling the person in the SNAP office, or they're calling the person at the hospital. Like, that's happening. And there aren't regulations around it. And then you look at a really big jurisdiction like Philadelphia or LA, where they have thousands and thousands and thousands of kids in care. They need this because they are drowning. They don't have the capacity to provide the quality of service these families need because they don't have the right technology supporting them. No offense, Philly. Just use you as an example of big. But, you know, I don't know if it was you that shared this quote with me or if it was Rachel a couple of weeks ago, but the Brene Brown quote that stories are just data with a soul. So all of these
It's one of
people
my
are,
favorites. Yep.
isn't it right? It probably was. All these people are talking to families in different capacities every day, gathering information. And we often talk about we don't want them to have to share their story twice, right? They're already in tough situations, but it's in addition to wanting to be respectful of them and their experiences and what they're going through, it also complicates our ability to properly serve people. And so the technology can help reduce that workforce burnout, which is still at very high levels, and then also create and also improve quality of data that we have. We can improve the accuracy and timeliness of the data that we have if we're all working together. Because if you talk to a family today, but I haven't talked to them since last month, you obviously have more current information than from what I had. And so we should be sharing that because circumstances often change, and perhaps now they need something different than what they needed last month. So tech really will free up our professionals to focus on the things that matter. And, you know, there's tons of ways to do that. And there are jurisdictions nationally that are doing some real good work right now around consent. If anybody's interested in that, reach out. I can give you some information on that. But also the HISI tag white paper that we published a couple of months ago does have information on that. Some of those spotlights, national spotlights of jurisdictions doing some of that good work. Let's roll out of tech and into like the role of community in system collaboration. And so when we talk about community, we talk about every person or system or team that's involved in a child or family's care, and how we all have shared accountability, right, for making sure that these folks are getting the care, benefits, and services that they need and are entitled to. So how do you think we could start to better collaborate in communities to address some of these, for lack of a better word, I'm going to say like broken systems? I don't know if they're broken. I don't know that they ever worked, but you know, that's what we're striving for. So where would somebody start, right? It's big, it's hairy. Where do we start?
Yeah, yeah, and so yeah, I like, this is my favorite part to talk about.
Yeah.
So I might drop some little tech things in there because I think
Yep.
like identifying where that supports what you want to be able to do, that's the key. And so, but your question, I always struggle with that, right? Because when I talk to families still today, I still think it's important. I highly value, and I spend, you know, I make sure that a good part of my week is engaging with families, youth or children doing those type of things, because I have to know what does it feel like to be them, right? Like what is their experience? And so it's always mind boggling. Like when we have this discussion, they'll look at me like a deer in the headlights, right? Because they're just like, I thought you guys had, like, you guys are the government systems. You don't have this collaboration thing all worked out. This is like you're asking me, and you all can't talk to one another. You guys don't, like it's, and I don't know how many times, Carol, like back in the day, like we would have convene huge community meetings, right? 60, 65 different providers at the table. We would spend 18 months hammering out, this is the MOU, let's everybody sign it like it's the declaration, right? Like all of us, everybody's signature on it. Now everybody go back to your office and do exactly what you've been doing the same way in your same silo that we've been doing before we spent that 24 months, right? And I think like some of the things, and again, that was, experience years and years ago, but I heard somebody use the example of, when you are giving your child access to the internet, right? Some people look at that as, you know, wow, you're giving your child access to the world. But some people say, no, you're giving the world access to your child, right?
Mm-hmm.
And so sometimes I think when we get stuck in these situations, it's worth flipping that telescope around and saying, so what are we doing? Like the ask and the desire to share information across systems isn't to put everybody's family on Instagram, whatever, right? It's the opposite. It's to make very transparent what our accountability and what our role and what our responsibility is in supporting and partnering with families to get them those through. Like, and so again, like, where I think we hear AI all the time, right? And some people's like, oh my gosh, this is awful, and this is the greatest thing since sliced bread. If that doesn't tell you how old I am, I still use the sliced bread analogy reference. But like even if when you talk about consent, imagine, right? I always do the imagine or the what ifs. Imagine if I have this consent to participate in whatever, right? And me as a social worker, there's a bunch of legal jargon, medical jargon, there's a bunch of all of these like rules and blah, blah, and all this type of stuff. And hey, Carol, if you sign this, this allows me and so to work together, right? It doesn't say all those type of things, but if I want to empower, if I really want to engage and build trust with the person I'm working with, that they know we're working in a transparent and they can make decisions and they're going to drive that, then why wouldn't I use an AI tool? I mean, I've done it with like ChatGPT or Copilot or any of those type of things. If you copy what is on a consent and say, hey, could you put this at an 8th grade reading level? Could you summarize this for me? Could you tell me what I'm agreeing to? And you can have a dialogue with the person when they're asking to sign that. Like, it's amazing. It's like, oh, and I mean, you're taking a couple of seconds, right, to walk through those type of things. We've seen them use it across, like I know in healthcare systems, they'll set and what they, in Epic, they have the ability to put flags on for certain things that they want to do. You can have tools that run across and say, hey, tell me where the flags are for this. Should this be on or should this be off? Should I contact somebody or should I not? Like there's some surface things that you can use that make things much more transparent and then allow us as we're working together with our providers. So if I go into a meeting with my community and I say, listen, I don't want this family's case to open up in child welfare, right? I don't want them to come in to me. Here's what you can do, right? Here's what this is where they've already been. This is what's worked for them in the past. This is where they've struggled. Here's who helps and here supports them. There's not a protective need. There's no immediate harm. There's no imminent danger. There's nothing going on like that right now. They just need some support to get through this next 72 hours or 2 weeks or whatever it is. I think that really starts to change when you engage again. When we say, okay, if I go upstream, I have all these providers up here, but the reason that we've been going down the stream the same way is we're not doing anything differently. I have to let somebody else take the wheel at that point. I have to help them be successful in taking the wheel and let them do those type of things, right? And I think we've, now again, when in my career, you are always very, very worried about, but if I do the wrong thing, a bad thing happens, we're sued, we're the headline of the paper, horrible outcome happened for a child. And I think, Carrie, you and I have talked about it, like when we go back to systems, I don't know if systems are broke. I think systems, if we think of systems, I think systems do exactly what a system does. The people within those areas, within those program areas, the way that they choose to use those systems or not use those systems or wield those systems, like you said, like, well, HIPAA says I'm not allowed to share. HIPAA doesn't say you can't share. It tells you
Right.
how you should share, right?
Yeah.
And those type of things. So I always look at it as like, well, a system or process was created for a very, very good reason, but it's designed to do exactly what it does. It's not having the conversation with the family. It doesn't hear the pain in mom's voice. It doesn't hear, a child wanting permanency in a forever family. It doesn't hear those type of things. The person does. So when you're within that system, if I'm not reaching out and engaging my partner and informing them as much as I can and giving them, because that's the best thing for this family, this child, then I don't know if the system's broke or the people that are working within the system are the ones that are allowing it to exist the way that it does.
Yeah. Yeah.
So it would be my
And so,
soapbox thing.
no, I love that. And sometimes systems need to change, right? Like a lot of these systems were built decades ago, right? Like, and when we say systems, we don't just mean technology, right? We mean system of care. And so, we have to revisit these things
Right,
once in a
right.
while. We do. And, as we all use, mobile devices every single day is just a very simple example of that. And if consent is really a bridge to service and a bridge to benefits and a bridge to bettering my situation, you can bet I'm going to say, yes, please, text me. And so, you touched on a couple of things with consent there that I did want to touch on. Like, first of all, absolutely include your clients, your parents, your older youth in whatever you're designing in terms of decision making in your consent process. But also, like, just think about, you were talking about the legal language. I've seen some really things like, I appreciate that you said to put it into layman's terms because you can't share I don't know how to read these legal documents. And how would we expect someone who might not even have a GED or who English isn't their first language to read something and agree to
Right.
it, not knowing what it means? And so some jurisdictions actually won't even let a client sign a consent form unless they sit down and speak with someone who can help them through it so that they fully understand
Right.
what they're agreeing to, which I think is great. Because if I just click, I mean, how many of us have like clicked, yeah, on something online? You don't read it at all. I do it all the time, but we don't want
Yeah.
our clients
Yeah.
doing
Yeah.
that.
Yeah. Yeah.
But the other aspect of that too is like, if you do these things, you're building trust with these clients, right? They're seeing that you do care about their well-being and they are included in the life of their case. There's this saying, I don't remember where it came from, but nothing about me without me, right? So if
Exactly.
you
Yep. Yep.
think
Yep.
that, and this gets back to AI too, like if let's say my circumstances change and I've agreed previously to allow consent to data share for certain purposes, but now my circumstances have changed and I might be eligible for something that I wasn't eligible for before. If AI picked up on that change in the system and was able to text me and say, "Hey, Carol, I see that you just got laid off from your job. You may now be eligible for this vocational training program, or perhaps you might need some rental assistance or some heating assistance."
Mm-hmm.
And it
Mm-hmm.
says, are you comfortable with us sharing your consent with that program so that they could determine your eligibility? You don't have to like do the eligibility, but just that touch point with me to say, hey, we have something else that might be beneficial to you. Are you comfortable with that? Yes, no. Let me decide that. It's very simple. We can communicate very simply and cost effectively. There are technology solutions out there that manage customer communications that are really reasonable and they can work across the enterprise. So I encourage people to look
Mm-hmm.
at those. If you need to know one, let me know, or two. But the other thing there is that, that involvement, that decision making, that regular communication goes a long way in empowering me to start to think about, how I can change my own circumstances a little bit, right? And I can be
Mm-hmm.
in
Mm-hmm.
charge of my destiny a little bit. And so I think that consent is a whole lot more than just benefits delivery. or requiring someone to make all their appointments or to return a form. There's so much more to it that affects the well-being of a client or a patient, that go far beyond process. Let's see, what else? Any other, like, I know we're kind of past our normal time on these things, but do you have other like
Oh gosh.
closing?
I could go for another 2 or 3 hours, right? If you want. Well, yeah, because I do, again, I really enjoyed my time as a frontline worker. I enjoyed interacting with families, and so I don't know if age has slowed me down because I always think like, man, I'd love to go back in it, and then I talked to a couple caseworkers. I thought, I don't know if I have the stamina to be a caseworker today.
Yeah,
So this is but like I said, I think this is for me and others that I've grown up with in my career, that I think this is the challenge, and I really just hope and encourage others, because I've seen some really super strong leaders at some states I've had to work with, and I even see them struggle with some of the teams that they have internally. I hope that they don't grow tired. Like, they should have demanded and insist on the people that they have in their policy department or is to be solution oriented. Um,
yeah,
I know that we said no for a long time because there wasn't a way, but now there is a way forward or around or through something, right? But we just have to define what it is. What are the things that are important, so we can build the new thing for our next group to kind of leap from. But okay, I think again, Carol, you and I had talked about before. If it wouldn't be good enough for me and my child, then how in the world do we accept it when we involve ourselves in the lives of others? I can't imagine that my child missed an appointment or didn't get something. We always think about like, well, we didn't do this because we didn't have this type of things. Well, again, flip the telescope around every now and then and say, well, how would you feel if your child missed something? Like, getting to work with some of the healthcare providers and hearing some of the stories about children who started a treatment but didn't get it completed, that went on a medication that required blood level checks but it never continued, right? Like, all of these different tools that can tell me and send me a reminder of, yeah, you have an appointment, when these things should be done. There was no way you would accept that for your child. No
no,
way that you would allow missed appointments and things to go undiagnosed or misdiagnosed or underdiagnosed, right? Or treatment plans to be put in place, or my child to go to one setting that is completely not conducive to their development because I didn't know what their full needs were, or a
yeah,
foster parent or a kinship parent that's failing because I didn't know how to offer them supports and training for the specific need, right?
yeah,
So I think that's the challenge in front of us. I think, for those of us that aren't writing case plans and going out and doing home visits and things like that every single day, don't forget those that are doing that. And so our job is to find a way through so they can do the work that we just talked about, because they're the ones that are saying, how much better this would be for the family and child. What the family wants and is expecting. Um,
hmm,
I can't get that because I hear policy and all these type of things, and so it's our job to create the new way.
yeah. No, and I think that, that's the case. Like, technology can be the catalyst, but right, it really is the mindset and the culture of the organization at the end of the day that will really propel some of this forward. And, I would end on, information sharing does not have to be a privacy risk, but it is a care imperative, right? And so if we want to provide better care, better service, and help our workforce, we need to make this happen. We've been talking about it far too long. It sounds big and scary and hairy, but just start with like one or two small use cases. That's what I would encourage you to do. Work with
Hmm.
one partner. Try to tackle something manageable out of the gate, maybe lower risk, right? And then figure it out and then build from there. You don't have to do it all at once, and it's not going to happen overnight. So any step forward is good.
Carol, that's my favorite part, and so if I can have my last comment will be one of my favorite quotes. I shared I started using it in my PowerPoint, or when we're having some discussion. It's from the book, the boy, the mole, the fox, and the horse. And the boy is saying, "Listen, I can't see a way through," said the boy, and says, "Well, can you see the next step?" "Yes." "Then just take that one," said the horse, right? And when we get in these, we hear like, "Gosh, let's boil the ocean. Let's get all the take whatever step is in front of you, start moving it forward. Then when we see and discover the next one, then we'll take that one on. But let's not deny families and children a higher quality of care because we're trying to figure it all out instead of just figuring out what the next step is."
Yeah, I appreciate that's a great ending point for us. And Rich, I'm so happy. I know we've been talking about doing this for a long time, and I'm thrilled that you were able to join us today. And I want to thank everybody who tunes in and listens to these podcasts. We really want to make it valuable. We want to encourage you. If you have questions for Rich or me, feel free to reach out. If you have ideas for a future podcast episode, send them my way as well. And we look forward to having you on a future episode of Vision to Value. Thank you, everyone.
Thanks, Carol.